Dr. Dubois-Blanc, what is the situation for you in New Orleans tonight as you fight this?
Well, over the last few days, we've seen things sort of plateau, which is, I think, a testament to all those people at home who have done exactly what I would ask them to do, is stay in your home and distance yourself. Like Jennifer said, the first week of this pandemic was exponential growth. We went from 1 or 2 patients to an ICU full of patients within a matter of days. And this is something that you really can't rehearse. We, like Jennifer, expanded our ICU footprint all over the healthcare system. And resources were strained, but we've had a tremendous outpouring of support from the community. We've had industry supply us with PPE. We have community members cooking for us, so we're not alone.
Dr. Dubois-Blanc, this is not the first time New Orleans has faced a life-challenging crisis like, of a grand scale. I didn't want to say like this because this one is so unique, but Hurricane Katrina, New Orleans has been through major crisis before. How does this compare to any of those preceding disasters that New Orleans has suffered?
Well, I was at ground zero for Hurricane Katrina, and the major difference is Katrina was a sprint. We had 5 days where we were hunkered down without resources caring for our critically ill patients. The outside world was intact and whole. This time, it's more like a marathon. We're into this now a month, and the entire United States and all of our surrounding communities are suffering along with us. So it's a very, very different experience than we had with Katrina. The numbers of patients, before Katrina, we evacuated as many patients as we could. So we only had a handful of people who were still in the hospital in our ICUs. I say a handful, maybe 50 in the hospital I was working in at the time, Charity Hospital. Whereas this time we have probably 10 times that number of people in our ICUs around the region. And it just goes on day after day after day. Just the last couple of days are the first time that we feel like maybe the worst is behind us.